I'm Sandy Lamb, the Division Chief of Pediatric Neurosurgery here at Lurie Children's Hospital, where we have a nationally ranked program in neuroscience.
I'm Jeffrey Raskin, Director of Pediatric Functional Neurosurgery, an epilepsy surgeon, and Associate Vice Chair of the Quality and Safety in the Department of Surgery.
1 in 26 people have a seizure in their lifetime. A seizure occurs when there is a sudden, uncontrolled burst of electrical activity in the brain. Let's take a look at what the procedure to place the responsive neurostimulator, or RNS, looks like. First, with the help of a cranial robot, the patient's head is mapped in 3D space in a process called registration. We create a system around the head like a GPS system, and this allows the surgical robot to move and firmly hold exact positions or trajectories that were determined before the surgery. Once the robot has driven to the proper trajectory, the surgeon is able to operate through the cranial robot, which guides instruments and leads or electrical sensors to the proper spot and depth.
The RNS device consists of two main parts that are connected with wire. The main part is called the neurostimulator, which is a battery-powered device that can record brain activity and deliver pulses of stimulation when appropriate. The second component is called a lead or electrode and is connected by coated wire to the neurostimulator. These leads are either placed on the surface of the brain or embedded into the brain. The neurostimulator is placed flush with the skull under the scalp. Once the device is implanted, brain activity is constantly monitored. As soon as patterns of oncoming seizure activity are detected, the neurostimulator responds within milliseconds, sending an electrical signal to the specific part of the brain, stopping a seizure before it happens, or preventing it from spreading further. These small pulses of stimulation cannot be felt by the patient. Data is able to be retrieved remotely without the need for additional surgery.
Our goal at Lurie Children's is always to partner with families to make decisions for care together and to give children their best chance to live to their fullest potential.